Hello, everyone. So we're going to be talking about chronic pain. What defines chronic pain? So in our studio today, we have Dr. Heather. Dr. Heather is a naturopathic physician based in Canada with focus on injury and pain management. Welcome, Dr. Heather.
Thank you for having me.
Sure. Yeah, so let's just talk about the definition of chronic pain.
Right. Yeah. So, I mean, pain in general is just describing like an uncomfortable sensation in the body. And it usually is stemming from some kind of nervous system dysregulation. So as a naturopathic physician, when I hear about pain can be coming from multiple different areas or like ways that pain can be generated. But usually it's really stemming from some type of inflammation in the body. And that inflammation is kind of sending that signal to the body and to our brain, causing that pain that allows us to know that something's not right and that we need to actually take care of it.
Okay, so and then the chronic pain is like if it persists for a certain number of days, is that what the chronic pain definition will be then?
Yeah. So when we talk about chronic pain, we're usually looking at something that's lasting more than 12 weeks or more than 3 months. Usually with chronic pain, we're also looking at something that even after maybe an injury is healed, or if there's been any kind of accident, we call chronic pain is even after that incident has happened and should have been resolved, we're still having pain with it. And that's kind of the difference between acute pain or like quick onset of pain that you may like stub your toe or break a bone. That's more of acute pain. But when we're actually seeing that pain lingering even after the injury is healed, that's when we consider it chronic pain. And it is if it's more than 3 or 4 months.
Okay. So, and what exactly, as a naturopathic physician, what are the recommendations? What is your toolkit?
Yeah. So, I mean, the naturopathic toolkit is a very broad toolkit. It's kind of like we have our hand in a whole bunch of different types of therapies. Usually when I'm looking at any type of pain in a patient, I'm looking at just in regard to like, do you mean like how I'm treating it, or do you mean?
Yeah. Like, acupuncture has a lot of, right? That's what I mean. We were talking about the regenerative injection therapy, things like that.
Right. Yeah. So with pain, and I mean, that's a huge focus in my practice and like primarily the focus of my practice. But if I see somebody coming in with a chronic pain injury, I'm looking at what is their diet like for one thing. Because usually if the body has enough resources and nutrients to be able to heal and actually help heal and actually cure or kind of work on getting rid of whatever the pain is, that's okay. But if the digestion is off and you're not actually absorbing nutrients, that's when we run into issues where the body's actually needing extra resources that it's not getting. So digestion is huge. I'm also looking at inflammation and how the body inflamed? Is there a lot of different like fires per se that we're trying to put out around the body, and the body's trying to kind of put out fires in all different areas that it doesn't actually have enough resources to actually put out an injury and actually bring the necessary cells into that area to heal. Other therapies that I use in regard to pain management would be like physical adjustments, like a chiropractor would do. In British Columbia and naturopathic medicine, our scope is quite large in regard to what we can do. And so we can do adjustments and mobilizations. We can do some soft tissue work to make sure that those muscles aren't really tight and kind of holding on as a protective mechanism around where an injury is. That can sometimes, if there's tight muscles, that can lead to pain in the area or referral pain. It can also, even if there's like nerve involvement, those tight muscles can actually be pinched around a nerve, actually causing nerve pain as well. So it's really important to kind of release those muscles that are kind of holding on as a protective mechanism to try and protect an area that's injured. I do use a lot of IV nutrient therapy to really boost a patient's nutrients and just give them the extra resources that they need to recover. I use acupuncture, and I can use that either like traditional Chinese acupuncture along the meridians, or even into muscles, which are sometimes called like dry needling, or dry needling. So, and then when it comes to injuries that kind of need a little bit extra push from the body in order to heal, because ultimately we're trying to get the body to heal itself. And it's just sometimes it needs that little nudge in the direction to kind of help with that. And then that's when I actually use regenerative injection therapies. So some people may have heard of those in, it's called prolotherapy, or using like a dextrose or sugar solution, or platelet-rich plasma therapy, where we're actually drawing blood from the patient, removing the red blood cells, and then actually re-injecting the platelets and growth factors from the patient's own blood back into the area of injury to stimulate a healing response.
Oh, wow. So, so that's amazing. So what is the, what time frame from the efficacy point of view? How much time does it take from the plasma therapy that you're talking about?
Yeah, so the platelet-rich plasma therapy is, it's one of my favorites, as well as the prolotherapy. Both are stimulating the same thing. It's just the mechanism of how it's doing it. When we're using the patient's own blood, I usually do a treatment once a month or once every 6 weeks. And that allows for those new cells that we've injected into that area to actually take on their new role and actually build into the tissue, whether it be a ligament, a tendon. It may help in stimulating muscle repair, and it can even help with cartilage to some extent, and into the joint to just help clear it out if there is any either inflammation, or if there's starting to be a little bit of arthritis. Those new cells are going in and actually clearing out what doesn't need to be there.
So now, as far as the pain threshold is concerned, right, depending on whether it's 4 or 5 versus more acute, like 8 or 9, does the therapy depend on the level of the pain that the person is going through?
Right. So pain is very subjective, right? To somebody, it may be a 2 or 3 out of 10. To other people, that may be an 8 or 9 out of 10. So pain is very subjective. I usually am going off how the patient feels, how it's impacting their life, how after doing orthopedic testing and doing like a full orthopedic assessment, that's when I'm looking at how I'm going to treat that. So if it is more of a severe injury that's just taking a long time to heal, the body just isn't giving enough resources to it. That's actually another thing, is when the body is in a chronic pain state, the body stops providing as many resources to the area after a while. So if you have an acute injury, the body's flooding everything towards that area to heal it. But if it becomes a chronic injury, the body stops kind of pushing as many healing factors to it, because it still has to, make sure that we have digestion going and all of our other processes to survive. So if there is a chronic injury, that's when we need to kind of support it with some extra therapy, like regenerative injection therapies. And that being said, also, it depends on the severity of the injury. So if somebody has like a small muscle tear, I may be more likely to use prolotherapy, which is using a dextrose or sugar solution that's actually causing controlled inflammation in that area to bring cells to that area to help heal. Whereas if it is more of a significant tear in either a ligament or in a muscle, then I'm more likely to use the PRP, or platelet-rich plasma therapy, just because it does have a higher, we're actually concentrating the cells from the patient's own blood and injecting that right into the area that needs that support. Ultimately, yeah, if there's somebody that's an athlete that needs to get back to training quicker than maybe somebody else, or there's something coming up that they need to get to, then I'm more likely to use more of the advanced therapies like PRP.
Oh, okay. So do you also use supplements and herbs along with these therapies that we're talking about?
I do, yeah. So as I said, like digestion is super important. And that was one of the first things I said in regard to the chronic pain or any type of injury. But I also I'm not a huge believer in keeping people on supplements for like a long period of time. I like to use it more to give them that boost and get their body back into functioning and getting the resources that it needs to help heal, but not to use supplements as like a crutch for actually getting those nutrients from the diet. So I do use supplements. I use a lot of anti-inflammatory supplements. I use a lot of vitamins and minerals and nutrients just to support the body in that healing, and also just combating any like extra stress that the body is under because of that injury.
And what about exercise? That's, I'm sure, plays a big role into healing process.
Exactly. Yeah. So, I mean, some of like the things are like, oh, if you're injured, don't move it or don't do anything that's going to cause further harm. It's ultimately, it depends on each individual person, because that's truly what I pride myself in the naturopathic field as, is like making an individualized treatment plan. People can come in with the same injury, but their healing journey is going to be individualized to them. So I usually work with each patient as to what kind of activities they can do. I'm not saying go and like run a marathon on your injury, but it's not helpful to just sit and not do anything, because you're not going to get that blood flow into that area. It's almost like a use it or lose it type thing, right? You need to be able to get the body back to functioning and keeping that range of motion, which is super important. Getting new blood flow, getting your body actually, and endorphins and different hormones working, which can actually help to reduce pain in that time period, as well as actually help in the healing process, because the body's like, I need to work, I need to heal this, and I need to get back to the activities that I do.
Sure. All right. So let's talk about some of the other myths or anything that people think about chronic pain and you like to tell them.
Sure. Yeah. So actually just some of the examples I thought of, like in regard to like, what is chronic pain? So, I mean, chronic pain can be everything from headaches to arthritis, which is like inflammation in a joint. Nerve pain can be a chronic pain issue, right? Because it's just that constant, it's not just like a couple days and then it gets better, like a sprained ankle. Back pain can be chronic, fibromyalgia, and joint pain. A lot of patients come in with these kind of chronic issues. They're like, I've had it for years. And I really try to educate those patients on, it's not about just living with this. It's like, you have pain, you have to live with it. There's nothing you can do. I do a lot of education in my practice in regard to that there are other therapies. Some people may have been told, it's just the way it is. This is your injury. You have to live with it. I don't believe that's always true. I don't also believe that patients need to be on medications for the rest of their life. Sometimes patients do, or they need to be on them for at least some time period. But it's really important to also work on decreasing inflammation, which I've said a couple times, working on diet, working on actually getting that body back to functioning in a way that it doesn't have to rely on medication. And there's a lot of patients that they're either in line for surgery or they're not a candidate for surgery at the time being, but they still have pain. And that's where my entire practice sits, is kind of in between maybe somebody saying you need to be on medication, or you're not in line for surgery, or your surgery date is 2 years away. There's a lot we can do. And there's a lot of patients have actually taken off of surgery lists by doing naturopathic treatments in regard to pain management, doing injection therapies, and kind of taking them off that list and getting them back into the activities they love.
Yeah, so I think the message is here to explore, other natural therapies. If someone, for whatever reason, is in chronic pain, surgery is obviously an option. We're not saying don't do the surgery. Absolutely. All we are saying is educating you to understand there are other options within the naturopathic medicine arena.
Absolutely. And you know what? I have a lot of medical doctors that I work with, which I that has always been a goal of mine, is to really have a very integrative approach to medicine in general. And there are definitely people that need surgery, and I'm happy to help them in supporting them before they go in for surgery and even after they've had the surgery, because there's a lot that we can do in regard to taking out pain after surgery as well. Like if they've had like a knee reconstruction or they've had an ACL repair, I can actually work a lot on that scarring that comes actually from the surgery to actually improve range of motion after, and also just help prevent any further like referral pain that can sometimes happen if there's like nerves that get trapped in a surgical scar, or just getting that patient's range of motion back.
Sure. Well, thank you so much, Dr. Heather, for being with us.
My pleasure.
Yeah, a lot of information on chronic pain management using naturopathic medicine, acupuncture, diet, movement. We talked about supplements, all combination. Anything else that you like to mention on this?
Yeah. No, I think, yeah, we mentioned them all in there, but it's really just, yeah, making sure that it's an individualized treatment plan for each patient and what they're going through and how their injuries and pain are affecting their life, and working with them to get them back to a spot that they're feeling better.
Sure. The message is explore naturopathic medicine. If you are feeling chronic pain, there might be a help for you. And you know, all the therapies that Dr. Heather explained, check it out and see if it will help you. So we've been talking about how to manage chronic pain with naturopathic medicine. Signing off now. Everyone have a great weekend. Thank you. Bye-bye.
Thanks.